Welcome to Ulosca channel. Access all nursing practice questions. RN Health Assessment Practice Questions with Answers.
Question 1. What is the correct order of assessment techniques for the abdomen? A. Inspection, palpation, percussion, auscultation. B. Inspection, auscultation, percussion, palpation. C. Palpation, percussion, auscultation, inspection. D. Auscultation, percussion, inspection, palpation. Which one is the correct answer? The correct answer is B. Inspection, auscultation, percussion, palpation. Explanation. In abdominal assessments, auscultation must follow inspection and come before palpation or percussion to avoid altering bowel sounds. This order helps detect true bowel activity and minimizes distortion of assessment findings. Question 2. A nurse notes that a patient's pupils are unequal in size. What is the medical term for this finding? A. Myopia. B. Nystagmus. C. Anisocoria. D. Photophobia. Which one is the correct answer? The correct answer is C. Anisocoria. Explanation. Anisocoria is the condition of unequal pupil sizes. It may be benign or signal a serious neurological issue, such as cranial nerve compression, increased intracranial pressure, or stroke. Careful evaluation is required to determine if the anisocoria is new or long-standing. Question 3. When percussing the lungs of a healthy adult, which sound is expected? A. Tympany. B. Dullness. C. Hyperresonance. D. Resonance. Which one is the correct answer? The correct answer is D. Resonance. Explanation. Resonance is the normal sound produced when percussing over lung tissue. It reflects healthy, air-filled alveoli. Dullness may indicate fluid or consolidation, while hyperresonance suggests hyperinflation. Question 4. Which of the following findings during a skin assessment requires immediate attention? A. Flat, even pigmented mole. B. Warm, dry skin. C. Skin to return in less than 2 seconds. D. Irregular border with color variation in a mole. Which one is the correct answer? The correct answer is D. Irregular border with color variation in a mole. Explanation. A mole with irregular borders and multiple colors is suspicious for melanoma. This finding warrants urgent dermatologic evaluation using the ABCD criteria: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolution over time. Question 5. Where should the nurse place the stethoscope to best hear the mitral valve? A. Second, right intercostal space. B. Third left intercostal space. C. Fifth left intercostal space at midclavicular line. D. Fourth right intercostal space. Which one is the correct answer? The correct answer is C. Fifth left intercostal space at midclavicular line. Explanation. The mitral valve is best auscultated at the apex of the heart, which is at the fifth intercostal space, midclavicular line. This location allows the nurse to detect murmurs or other abnormalities in mitral valve function. Question 6. A nurse assesses a patient with clubbing of the fingers. This is most commonly associated with A. Dehydration. B. Chronic hypoxia. C. Liver failure. D. Hypertension. Which one is the correct answer? The correct answer is B. Chronic hypoxia. Explanation. Clubbing is a physical change in the fingers and nails that often result from chronic hypoxia, commonly seen in chronic lung diseases or congenital heart defects. It is a compensatory mechanism due to long-term oxygen deprivation. Question 7. Which cranial nerve is being tested when the nurse asks the patient to stick out their tongue? A. CN9, also known as glossopharyngeal. B. CN10, also known as vagus. C. CN11, also known as spinal accessory. D. CN12, also known as hypoglossal. Which one is the correct answer? The correct answer is D. CN12, also known as hypoglossal. Explanation. The hypoglossal nerve controls tongue movement. Having the patient stick out their tongue assesses motor function and symmetry. Deviation to one side can indicate nerve damage or stroke. Question 8. Which assessment finding is expected in a normal adult when checking capillary refill? A. Greater than 3 seconds. B. Less than 2 seconds. C. Fingers pale when pressed. D. Slow return of pink color. Which one is the correct answer? The correct answer is B. Less than 2 seconds. Explanation. A capillary refill time of less than 2 seconds indicates adequate perfusion and cardiac output. Delays beyond 3 seconds may suggest poor circulation, dehydration, or shock and warrant further assessment. Question 9. A nurse hears a bruit over the carotid artery. What does this indicate? A. Normal blood flow. B. Obstructed venous return. C. Turbulent blood flow. D. Valve regurgitation. Which one is the correct answer? The correct answer is C. Turbulent blood flow. Explanation. A bruit is a swooshing sound heard over an artery, typically caused by turbulent blood flow due to arterial narrowing or plaque. This is often associated with atherosclerosis and can signal increased risk of stroke. Question 10. What is the best method for assessing edema in the lower extremities? A. Measure calf circumference. B. Palpate for pitting. C. Check capillary refill. D. Observe skin color. Which one is the correct answer? The correct answer is B. Palpate for pitting. Explanation. The nurse should palpate over bony prominences like the tibia or ankles to check for pitting edema, which is indicated by an indentation that remains after pressure is applied. This helps determine the severity and grading of fluid accumulation.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.